All right, here we're with Kate, and Kate has a small cavity on an upper molar. Going to take a quick look at it. Pretty shallow, so we can use air abrasion. That's what I'm using now. I'm shooting aluminum oxide powder at the tooth. We did not need a needle or a drill here. Acts like a little mini sandblaster, blasting the decay out of there. She won't have to worry about being numbed up for 3 hours after this procedure is over. Make sure we get all the powder suctioned out. She's doing fine. I have Erin helping us here. Have her rinse out. Well, the filling's prepared. We're going to put a little etch on the tooth. Rinse that off. Put some primer now inside the tooth. The light cure that using an LED light here. Put the bonding agent on the tooth. Light cure that again. It's important to isolate the tooth and keep it dry while we're working with composite or the white filling. We're going to go ahead and put a flowable composite into this small cavity. I'm going to light cure that. Here we're isolating the tooth and keeping it dry with cotton roll and gauze. Some dentists prefer a rubber dam here, rubber barrier here. That's fine as well. Checking her bite. It's a little bit high. She's tapping it when she bites, so we're going to adjust that. Go ahead and smooth that down and try it again. See how she's doing. Still biting on it a little. Adjust it again. It's better. Just going to polish it a little bit. Smooth it down a little. Wipe that off. Looks good. Can hardly tell anything was done there. All right, Kate, it wasn't too bad, was it?
Nope.
Didn't hurt?
No, not at all.
So for small to medium-sized cavities, we can often use needleless techniques like air abrasion and no needle, no drill, and the patients love it, really. For more detailed scientific and medical information, please continue to watch this video. Now we're going to go ahead and etch the tooth. That's a 40% orthophosphoric acid gel. Get the tooth isolated with a cotton roll. Go ahead and let that stay on for about 10 to 15 seconds. Rinse that off. Looks fine. Now we're going to use a primer. Increases the reactivity of the dentin underneath. It makes the collagen fibers stick out. Go ahead and light cure that. We're going to go ahead and put the bonding agent on, a bond to the dent and the enamel. Make sure that that's thin layer. We're going to go ahead and light cure that as well using an LED light, keeping the area isolated and dry, looking away from the light because it can damage your eyes if you look right into it. Now we're going to go ahead and put a flowable composite in there. It's a microfill. It's good for shallow cavities within the grooves of the tooth. Go ahead and light cure that. Make sure she's not hitting on the tooth. Go ahead and adjust that for her. Going to go ahead and polish it a little bit now. Looks good. Can't even tell that there's anything done to that tooth.